We're here today for the inaugural HSJ ICS Medicines Forum. Been talking about a lot of topic areas, people really enthusiastic to contribute. After the worst of the COVID pandemic's been over, that's caused people to be focused elsewhere, and they've also been through a major shift in the pharmacy landscape. Some people moving from clinical commissioning groups to integrated care boards. And we've had panel sessions across value, medicines optimisation, health inequalities, also considered the financial pressures affecting pharmacy as much as any other area.
The biggest challenge we've got with this delegation of specialised services into ICS is how do we ensure that we don't get postcode prescribing and that we continue to have access for those innovative medicines, but also not delay their implementation, which is also a potential risk. How do we as a system ensure we continue to deliver the medicine agenda?
This forum has allowed us to explore some really great examples of how systems have evolved, where we can demonstrate value, and it's not always about saving money, it's about what can we do for the patient, how do we revolutionise things and move into the new system.
Some of the challenges are around workforce, recruitment and retention. The analogy is there's a pie and everybody wants a piece of that. We need to grow staff and develop them and diversify what we do as pharmacists to empower those staff to take on different roles. We can't do the status quo. We need to change and verify what we do.
We saw during the pandemic the value of collaboration and our relationships within pharmacy. I think the future is taking the person's perspective, that personalised care, and how can we adopt the way we approach medicines optimisation to really give value to individuals as well as our population.
One of the simplest things is of being able to use medicines in a more targeted and effective manner, such as genomics, targeted, precise medicines that will transform medicines optimization, identifying which cohorts of patients will get the best outcomes from a particular medicine.
We were talking about how the system works together to bring access to innovative medicines, to support for clinical leadership and people on the front line, through to using our power as a national purchaser in support of ICSs and our commercial capabilities to make sure that we're getting the best deals at population level and bringing those innovations to patients.
Value shouldn't just be linked to the drug cost. It's about how does that drug let the person have a meaningful life. If the drug is slightly more expensive, but it allows the patient to have meaningful employment, reduce readmissions into hospitals, then actually that investment is worth it. Today we've had NICE, the MHRA, NHS England, and I've not seen another forum connect these different people who almost have the same objective but are perhaps working in slightly different ways.
There's been a real buzz in the room, lots of collaborative problem solving.
There is a lot of learning that needs to be done through this process, but these conversations allow us to understand that.